Hello, it's Julian here at Aardvark, the remote first aid instructor and consultant. Today what we're going to talk about is a chest seal. So your casualty has got either an open pneumothorax or a tension pneumothorax, which means they've been shot in the chest, which basically it's otherwise in layman's terms it's known as a sucking of the chest wound. Signs and symptoms are they'll be coughing up bright red frothy blood. Okay, one side of the chest is going up, the other side isn't. I always think they make a sound like a sea lion that's got sore throat. There's a noticeable difference. Okay, the average adult's breathing rate is 12 to 16 breaths a minute. So what's happening is one side you've got a paradoxical movement, so one side of the chest is going up, the other side isn't. A later stage is the deviation of the trachea. So the open pneumothorax is called an open pneumothorax. First of all, it's open. Pneumo, there's air coming in and out. Thorax, your chest area, that's a posh medical term for the thoracic cavity. Okay, so how do we fix this? First of all, your casualty needs to be sat how I am. Okay, in basically the W position. You expose the wound, cut away, have a look, that frothy bright red blood is bubbling out. Hand goes over, you lean them over to the injured side, because what we don't want to do is going to take it over to the non-injured side, because as well as that there's fluid starting to build up. They might have a massive hemothorax, which means there's lots of build up of blood into the actual cavity. Fox chest seal comes in two in the packet. First of all, clean the wound off. Okay, get it nice and clean. All you then do is you peel back. As you can see there's a jelly substance. So my advice is put it down there and peel it down. Put it onto the chest of the casualty. Keep them over to the injured side. Remember I said the average adult's breathing rate is 12 to 16 breaths a minute. If they've got a sucking or a chest wound, it'll go up to about 30 breaths a minute. This is your medical evacuation straight away. If you can't get them in to the W, if you haven't got a tree around you or a wall or anything like that, the best position is into the recovery position. One of the things that you need to be careful of the open pneumothorax is it could eventually turn into a tension pneumothorax. So a tension pneumothorax is an air build up in the pleural cavity. So around our lungs we've got the pleural cavity. So the open pneumothorax, the air is coming in and out. Tension pneumothorax, instead of the air coming in and out, that air is coming in. So that's going to push on the pleural cavity. It's going to push over, keep pushing over, keep pushing over. Eventually that's going to push onto the heart. What's happening is the heart is going to go increase, and then what's happened, your casualty is going to go into cardiac arrest, which means you have to do cardiopulmonary resuscitation because the heart has stopped completely. And so these are the dangers. So this is basically, if you're on a triage obviously stage of your casualties, this is a T1 casualty that needs to be medically evacuated straight away, and you have to make sure that watch out for that it doesn't develop from the open pneumothorax into the tension pneumothorax. Hope this has been helpful. If you'd like to know more about this products, drop us an email at Aardvark, or also have a look at the website where we'll be happy to answer any questions that you may have. Thank you.